Hi everyone, so I'm going to be doing a review for your Psych midterm. Um, so your Johari window is the first thing that was on your um, blueprint. So this is all dealing with self-awareness. Um, just make sure it's recording. Yes. All right. So this is the most important therapeutic tool used by the registered nurse is the self. So because of this, the RN needs to be aware of his or her thoughts, feelings, actions, values, and needs in order to provide care effectively. So self-awareness allows an individual to get in touch with the various components or parts of the self as they exist in any at any point in time and space. So this is the window that Dr. D has provided. So this is what's known to self and what's known to others. That is your public self. This is what you want to be perceived as, and that is what you put out there. So usually what we put out there is we try to be very positive. This is very superficial. Um, and we want to be accepted and liked. Um, Semi-public self is not known to self, but known to others. So this is how other people see us. So in order to, understand how other people see us, we usually ask people for feedback. So a tool of communication that opens up the semi-public self and help the individual develop a greater awareness of themselves as others see them. So if you ever ask someone for feedback, that is what you're doing. It's not known to you, but it's more known to others and how others see you and perceive you. Um, Next is what's not known to others, but what's known to self. So that's your private self. So your secrets, demons, negative thoughts and feelings, private personal thoughts and feelings. So this is self-disclosure, process of communication by which one person reveals information about themselves to another. All right, which is pretty self-explanatory. And then you have your inner self, which is not known to self and not known to others. So area of unknown, unconscious, not known. So an example of that would be anxiety, which is a defense mechanism. Usually we're not really aware, our heart's racing, we're feeling nervous. Sometimes you don't even know if you're having anxiety, but you're feeling nervous and things like that. All right. And sometimes even people are not able to see if you're anxious. So as you can see, that could be not known to self and not known to others. All right. How do we develop self-awareness? You want to listen to yourselves, listen to your feelings, thoughts, and behaviors, identify, name thoughts, feelings, and behaviors, look for precipitating event, cause what has caused you to feel that way, and then you listen to others. Feedback, to a communication that opens up the semi-public self and help the individual develop a greater awareness of themselves as others see them. Self-disclosure, this is when you tell others about yourself. Let others listen. Depends on characteristic of listener. Are they non-judgmental? Are they trustworthy? Can they keep it confidential? Are they honest, caring, compassionate? This self-disclosure is risk-taking because you don't know how that other person is going to react to you opening up to them about personal feelings and beliefs. So honestly, know your window. I remember from last year, you really just need to know like the whole window, like what is private self? You know that this is known to you, but not known to others, right? And know your these stars, know what's bolded, what is associated with feedback, semi-public self. So just try to understand this whole thing and memorize it, know what's underneath, what is underneath private self, self-disclosure, what's underneath semi-public self, feedback. I believe the question from last year was mainly dealing with like semi-public self, because feedback is important. Um, So all of that's important. Know your window. Know what's known to self, what's known to others, everything like that. But it's pretty self-explanatory. Um, all right. So moving on from the window and self-awareness, we're gonna go into nonverbal communication. So these are four ways in which nonverbal communication and behavior can be expressed. So study all of these. These were all on the midterm last year. So kinesics is the study of body movements. Our body movements are most often unconscious and not aware. Our body movements communicate a message. So you always want to pay attention with body movements, all right? So facial expression. Face is the most important source of our emotions. So, if you look make a grimacing face, things like that, that can be perceived by the patient. All right. Posture, the way you carry yourself, the way you sit, stands, sends a message. So posture can be open or closed. So usually when you're trying to be therapeutic, you want to have an open posture, right? Gestures are kinesics as well. Um, and then eye contact as well. Direct eye contact is an invitation to connect. So eye contact is culturally um, so direct eye contact is an invitation to connect. So just remember that it does depend on culture if a patient um, can connect with you. So touch, you always get consent and ask because it depends on culture as well. It's what you want to take into consideration. So you want to respect the reaction you're getting and pay attention to the message the client is conveying, right? It's kinesics. Paralanguage is the way we use our voices, which sends the message. So that depends on the tone of voice, inflection, spacing of words between words emphasized and pauses. So non-language vocalizations, sobbing, grunting, laughing, tisking, crying, sighing, yawning, all things like that. Proxemics is the study of spatial relationships during personal relationships. So territoriality, fixed defined space as customarily marked by a person to prevent intrusion by others. So it's like when you get in a room, you want to ask the client if you can sit in their chair, just because they may be territorial, that that's their chair in their room. They don't want anyone else sitting in it but them. Personal space, portable territory surrounding the self and acting as an invisible barrier beyond which others are not expected to trespass. Use of space varies by culture. Hall 1966 believes people interact in four spatial zones. So we have the intimate zone, so that is 0 to 18 inches around the body, maximum interpersonal sensory stimulation, zone of physical contact, inevitable and expected physical contact. So this is when a person is being touched and someone's very, very close to them. Visual focus sharpened in details because that person's very close. Height and smell, heat from another's body, so you feel the heat, sorry for that, heat. Vocalizations low, personal zone, 18 inches to 4 feet, close contact possible. Focus on whole body where you can actually see the whole body then, because here you can only see like a small area of the body since that person is so close. Bubble person keeps between self and others. Bubble can contract or expand. Personal zone is the zone of the nurse patient relationship. This is what it should be, where you're not super close, but you're also not super far. Um, and then you have your social zone, which is farther. And then poverty zone, which is even farther. It can be 12 to 25 feet and beyond. Physical appearance is the way in which people use clothing and other personal objects to convey an image. So jewelry, hairstyles, all things like that. Non-judgmental attitude. Change in physical appearance can be the first indication of a developing problem or signs of suicidal thoughts. So if a person's starting to look very disheveled, their hair is a mess. And especially like bipolar disorder, when a patient is cycling through mania, they usually wear like really bright colors and lots of makeup, things like that. Um, and yeah, and like when a person's depressed, they may not care how they're looking or how they're being perceived, so they can look very disheveled and messy. Verbal communication behavior is the words we speak. Verbal and nonverbal communication behavior have to fit together. So the words you speak and what you do nonverbally should match. So your verbal and nonverbal communication should confirm, they should be congruent, which means that they match each other. So what you're saying and what you're doing needs to match. Um, so if you're saying to the patient, I hope you feel better, but you're sort of not like smiling, or you're not making a polite face, and you're sort of just like grimacing, if your facial expressions aren't really matching what you're saying, the patient is not going to um, perceive it as you really mean it. So it's basically validity between what you see and hear. If you tell a patient, I hope you feel better, and you're smiling and you have open posture and things like that, that's confirming. what you're saying. Complement each other as well. So again, congruent and match. Nonverbal strengthens, complements, and emphasizes verbal communication because they need to match in order for a patient to like believe what you're saying and what you mean. Contradict, incongruent, they do not match. Verbal and nonverbal do not agree, then the communication is confusing. Always believe nonverbal communications and behavior. So a patient is always going to believe what you do nonverbally, not really going to believe what you say verbally unless your nonverbal communication is matching. Um, things like that. So we just really just needed to match, which if they don't match that, it's not going to come across nicely. Types of relationships. You have social relationships is a relationship that's primarily initiated for purpose of friendship, intimacy, socialization, enjoyment, or accomplishing a task. So with a social relationship, it's like you guys are mutuals, you help one another, things like that. You also can give advice to one another, but you have to meet the dependency needs of one another. A collegial relationship is a relationship that occurs among colleagues. So confidentiality, HIPAA, was also on your blueprint. So this is all information shared by the client with me as the nurse must be shared with the treatment team. So the treatment team includes the doctor, it can include the OT, the PT, behavioral analyst, things like that, the therapist. It needs to be shared with them because um, all information the patient is only allowed to be shared with people directly involved in the care. You shouldn't be sharing information with a nurse on a different department, you're not saying the name and things like that. You should not be doing that. Only the treatment team themselves. All right. So, therapeutic relationship is the relationship that takes place between nurse and patient, a helping relationship in which the nurse focuses on the patient. The nurse is a therapeutic agent. All right. So, the nurse is focusing on the patient. The nurse should not be looking for advice from the patient. That's all that is saying. You are there for the patient. You're not there to get advice, things like that. You are the therapeutic agent, right? A little bit about confidentiality, but we all know what it is. So the questions are pretty simple regarding it. The definition is all information shared by the patient with me, the nurse, must be shared with the treatment team. Who is the treatment team? Those individuals directly providing care for the patient, HIPAA and protected health information. This law focuses on maintaining the privacy of electronic transfer and storage of health information and communication. Release of information form has to be signed by the client. It tells you who, what, where, when, how the information can be revealed. So then it's the nurse's responsibility to know who, what, when, where, and how, and should always check the release of information form before releasing information. So if someone's mother comes in and they're not on that form, then you can't share the information. But if they are on that form, then you can. Release of information form ends when patient is discharged, and patient must fill out new release of information form every time they go into the hospital. All right. Attending skills is just another word for nonverbal skills. So you have therapeutic and non-therapeutic nonverbal skills. So therapeutic is when you're looking at the client, when you were talking with him or her. Non-therapeutic is the complete opposite. You're looking away. You're not focused on the client. You're not looking at them. Therapeutic, you're maintaining an open posture, sitting and standing. Open, when you're facing the client, you're looking at them. Closed posture, when you're sitting or standing, where you're not really facing them, things like that. Leans towards the client, sign of presence, availability, involvement, right? Down there, you're leaning away from the client, you're staying far away from them. 4, you're maintaining direct contact at same eye level. You need to be same eye level. Don't be standing when they're sitting and where you're above them and you're looking down at them. That's not going to make them feel, it's not very therapeutic for them. All right. You sort of come off as a authority figure when really you guys need to be having a therapeutic relationship, talking to one another. But you do need to remember your cultural differences when it comes to eye contact. Non-therapeutic is staring, blinking, not at same eye level. So one sitting, one standing. Like I said, don't do that because you're going to come off as like a really big authority figure and they're not going to feel very open to connect with you. Remain relaxed, stand or sit quietly without excessive movement or fidgeting. Excessive movement or fidgeting, shifting weight back and forth on feet is not Therapeutic, it's sort of telling me that like you're in a rush and you can't wait to get out of that room. All right. Give that client the time that they need to speak, give them the time. All right. Create a relaxed environment, concern about environment where interaction is taking place. Privacy is a degree to which people can interact without distraction, interference, or loss of confidentiality. So a private room, take them to a private room that all patients are entitled to confidentiality. They don't want their business being spread, right? Comfort as well relates to factors such as seating, lighting, noise level, and space territoriality. And remember your cultural differences always. 6 is you're not therapeutic, so ignore environment, lack of privacy, and comfort. All right. Responding skills, what the nurse says to the client. Therapeutic, these are all important. This always comes up, like even NCLEX questions. You need to know like what you can or cannot say. So this is verbal, what you say to the client. Therapeutic, effective is what helps the client continue talking. It focuses on the client's thoughts, feelings, and behaviors, and it works in opening communication, right? We want to focus on that client. We want them to open up to us, all right? So we do that by focusing on them, making them feel seen. Non-therapeutic is you're not focusing on them. You're closing, you're stopping communication, you're ignoring them, and they can sense that you're ignoring their feelings and behaviors. Um, and these are a list of ineffective words or sayings in which basically all these words they're doing, they're ignoring how the client is feeling. All right. Memorize this. Actually, like memorize all of these because this is going to help you with the questions. All right. All of these, memorize it. All right. And there's 7, right? Even now, like with community health too, I memorized all these because you need to know with therapeutic communication what you cannot say. Whenever you see this off the bat, you know that it's wrong and you know that it's not therapeutic. All right. So everything will be all right. You're never gonna say that to a patient because it's not gonna reassure them. You need to focus on your feelings and you're not focusing on them. And this is also like seen as false reassurance. You don't know that. Also, you don't say don't worry. All right. False reassurance. And you're not focusing on them. You're ignoring how they're feeling. You're never gonna say good or bad or right or wrong or agree or disagree. It's not up to you to say those things or tell a client really what to do. That's not up to you to tell them what to do. Exactly with this, you never tell them should. You're not the one telling them what to do. It's for them to decide. You never say why, all right? And you never use the words angry, hostile, or guilty. Like if you say to a client, "Are you feeling guilty?" They may not like you saying that word. They're going to get really defensive and angry. So never use angry, hostile, guilty. Never say, "Are you angry? Are you feeling hostile? Are you feeling guilty?" Never say those. So definitely memorize all of these and they'll help you with all your questions. And this chart is sort of just like repeating everything we said. Therapeutic. That's what opens and facilitates communication. Non-therapeutic closes, blocks communication. Therapeutic, effective works. Ineffective doesn't work. This focuses on the client's thoughts, feelings, actions, and behaviors. Non-therapeutic ignores client's thoughts, feelings, actions, and behaviors. So again, everything we discussed. All right, defense mechanisms. So for your defense mechanisms, that's majority of your test. So you need to understand all of them, and I definitely recommend going over all the homeworks you got to do dealing with defense mechanisms. It helps you understand the difference. All right, look at all your examples. I wrote all the examples here that I have had. But your test is probably mainly just going to be defense mechanisms and therapeutic communication. So thought blocking is an unconscious defense mechanism, meaning that the client is not aware. So it is a sudden stoppage of thought. This usually indicates conflict or anxiety. So honestly, sometimes I get this too. If I'm getting like overstimulated and then anxious, I'll sometimes just stop what I'm saying because I'm getting super overstimulated. Compensation. This is unconscious as well. So you make up for what you were lacking in by excelling in something else. So these are all the examples here. So a physically handicapped boy is unable to participate in football, so he compensates by becoming a great scholar in school academically. A paraplegic, which means that someone is paralyzed with the feet, becomes a competitive arm wrestler. So, they can't really use their feet, so now they're going to become an arm wrestler. So they're compensating by being great in something else. A student who thinks he is not intelligent as the others in his class is using compensation when he studies very hard and makes the top grade. Jane, a rather unattractive woman, dresses like a fashion plate to attract attention. Chuck is awkward in sports activities and puts his energies into being an honor student. All right. And here's the picture. I may be short, but I know basketball. All right. This person is short, they're not really able to play basketball as well as others who are taller. So they become a coach. All right. Conversion is also another unconscious defense mechanism. It's a psychological or emotional difficulties are converted into sensory or motor difficulties. So this one isn't too bad as well. So a young woman suddenly experiences chest pain after arguing with her husband. A young prize fighter becomes very upset with his father and attempts to throw a right punch. His right arm becomes paralyzed as he tries to remove it. So this person is dealing with something that's very upsetting them, and then physically, um, sensory, where they're not able to. So you're thinking of the five senses, and you're thinking of motor difficulties. This person is having chest pain. That's more so dealing with sensory, right? They're feeling the chest pain. This one here is also dealing with motor. This one's actually dealing with motor. You try to throw a punch, and then, you know, they feel paralyzed. This one is a good picture as well. This husband is telling his wife he wants a divorce. She is having a sensory reaction where she's not hearing him and saying that he's mumbling. All right. So it's just something that is psychologically harming someone that's now impacting their motor and sensory function. All right. Next is denial, which is pretty self explanatory. It's unconscious, blocks awareness of reality by refusing to acknowledge its existence. So a woman drinks alcohol every day and cannot stop, failing to acknowledge that she has a problem. A person is living on the slope below a glacier, disregards the danger it presents. Mary Jones has just been told her husband has cancer. She asks the doctor to repeat some laboratory work because she feels certain the technician made a mistake. And Helen is unable to face the reality that she has a terminal illness. And this is a good one. There is no need to get knife happy. I've decided to seek my fourth option opinion about having this tumor removed. So this patient already seen three um, doctors for opinions. Now they're going to go to the fourth opinion. So they're in denial. They're going to go get another opinion, even though they already had three. So those are all that. Next is displacement, is another unconscious one. It's emotional feeling is transferred from its actual object to a substitute or less threatening substitute. So this also was a practice question on Archer. So definitely needing to know your defense mechanism is really important because you never know if you're just gonna become an in-class question. So a client is angry at his physician, does not express it, but becomes verbally abusive with the nurse. So basically, you're upset at someone else, but you're, reflecting it onto someone else. Yelling at the dog after an argument with one's spouse. Jim Williams, an executive whose days did not go smoothly, immediately criticizes his wife when he arrives home for dinner. Bob took out his own on the job, frustrations on his wife and children. Right, and this just shows a picture of a man getting yelled at work and then taking out all that frustration on his child. All right. Next is fantasy, which can be conscious and unconscious. So free wandering of imagination, promptly corrected by reality. So daydreaming. So it can be conscious or unconscious. Sometimes we daydream, that's conscious. Sometimes unconscious as well. A shy 15-year-old girl daydreams about being glamorous, beautiful, and rich. Right? That's conscious. She's doing it herself. Identification, unconscious. The unconscious adoption of some of the characteristics of another person is the end result of introjection, which we'll talk about. So a teenager who required lengthy rehab after an accident decides to become a physical therapist as a result of his experiences. Bill Smith imitates the characteristics and actions of one of the actors on his favorite television show. And you see this little girl is identifying and adopting characteristics of a nurse. Okay, introjection, unconscious, psychological process whereby a quality or attribute of another person is consciously taken into and made part of that subject's personality. So children integrate their parents' value systems into the process of conscious formation. A child says to a friend, "Don't cheat." it's wrong. So that's that. And then this is just like the end result of introjection. So we'll usually have introjection where we're gaining like a lot of beliefs and things from other people, and then introjection is the end result, like you actually identifying and adopting those characteristics of another person. All right. Intellectualization is also unconscious. It's the analysis of a problem, avoid effect, endeavor to name and define instead of avowing feeling, escape world or emotion into a world of intellectual concepts and words. There's no emotion, basically just describing the effects of something. So S's husband is being transferred with his job to a city far away from her parents. She has anxiety which explains the advantages associated with the move. So not really going deeper, not facing emotions, things like that. Just stating like the facts. Emotional isolation is unconscious, so protection of self from anxiety provoking situations or separation of disturbing ideas from effect. So a young woman describes being attacked and raped without showing any emotion. Carl White witnessed an accident while en route to work as he describes the accident to his secretary. She comments, "You're a school's cucumber, didn't the accident upset you?" 6 months after the death, after the son of Jeff discusses it without experiencing earlier painful feelings. So you're basically just isolating all your emotions, not showing it. Projection, I'm pretty self-explanatory for this one. So it's unconscious, a technique whereby feelings, wishes, and attitudes originating within the subject are attributes by him to other persons or objects in the environment. So this is all just dealing with blaming someone else. And here are your examples here. So Sue feels a strong sexual attraction to her track host and tells her friend he's coming on to me. So whenever you're questioning blaming someone else, that's all you're dealing with projection. In describing personality characteristics of an acquaintance, a man says he is hostile, prejudiced, rigid, and stubborn. He hasn't read that these are predominant characteristics in himself and that he is using projection. All right. This is also another good one. Luther blames his wife frigidly for his own infidelity. All right. Rationalization. This one's also a pretty easy one. So it's unconscious, logical, or feasible excuses for actions. So John tells the rehab nurse, "I drink because it's the only way I can deal with my bad marriage and my worst job. Sorry, I'm late. My car kept stalling." Bea feels awkward socially and avoids dating by saying she prefers to sit and watch TV alone. So basically, you're just rationalizing something that you've done. You have a reason for why you did it. All right, reaction formation is unconscious. You're basically, this one isn't bad either. You just want to think that you're having opposite thoughts and with opposite feelings. So let me pick one of the good ones. For example, Jane hates nursing. She attended nursing school to please her parents. During career day, she speaks to prospective students about the excellence of nursing as a career. So basically, she has opposite thoughts, opposite feelings. Um, then what is she projecting to other people? So whenever this is a good example. I think it was like something like last year too on the midterm. So just whenever you see something that says opposite thoughts and opposite feelings, then that's going to be your answer. Even this picture where she says, "Aren't you the little sweetums?" But in her head, she's thinking this. So that's like a bad baby. She's just having opposite thoughts and opposite feelings. Um, Regression is unconscious. It's a more immature way of behaving that's not age appropriate or developmentally appropriate. So like usually when a child is hospitalized, sometimes they regress, meaning that like a child who is 4 years old is supposed to be potty trained and now they're wetting the bed. So that's an example of regression. Like they're already potty trained, but now they're wetting the bed. So usually children, when they're into the hospital setting for a while, they usually regress. That's an example of that. Some other examples. Um, all right, as you can see, this guy's playing with blocks. So he's regressing. That's usually what we do as kids, as an adult. Um, Repression is also unconscious, a technique whereby thoughts, emotions, and sensations are thrust out of consciousness. And the main thing with this one is just saying like, I can't remember. Like they just can't, they're repressing that memory altogether, and they cannot remember that memory. So an accident victim remember, can't remember nothing about his accident. sorry, can't remember. Let me pause that. Um, an accountant is unable to recall the reason for his argument with his boss. A woman who's very guarded about sharing confidences tells an acquaintance about an embarrassing experience. When she sees a person a few days after, where passion prevents her recalling the conversation, even when she's reminded of it. So it's all things about like when you have a question saying like basically the client can't remember, that's all you're dealing with repression. Sublimation is also unconscious. Anxiety, anger, aggression is transferring into a socially accepted behavior. So a young man with urges towards aggressive behavior becomes a policeman. By use of sublimation, he channels aggression into productive, useful work. Last year, it was a question like this. So basically, someone who's usually aggressive becomes a boxer, right? So they're putting it into that, or like working out all those angers and things like that. Um, so last year, I believe it was like a boxer question on the midterm. Um, as you can see, this person redirected their destructive impulses into, becoming a surgeon, right? But you can also become like an athlete or policeman, things like that. Um, substitution. Substitute is unconscious. Substitute one thing for another. So a laboratory technician is unhappy with her work and elects to become a medical secretary. Charlotte Green always wanted to be a nurse. When she realized that her grades were not good enough, she stayed in this program. She had decided to become um, a medical receptionist. All right, so you're just substituting one thing for another. So this didn't work out, so they're gonna do this instead. Suppression. Know that this is a conscious one. So suppression and fantasy are your only conscious ones. This is when you're consciously putting something out of your mind, undesirable thoughts or events, like I've had enough or I'm taking a break. I don't want to think about that now. I'll think about that tomorrow. I rather not discuss my problems with you. When asked if she would care to talk about her husband's conditions, Mary Jones says, I'd rather not talk about it right now. So it's like the patient is willingly saying, I'm not going to talk about this with you right now. That is conscious. They know what's going on. They just don't want to think about it and talk about it. All right, this picture just says I'm taking a vacation from my problems, just not paying attention to it, just leaving the problem. You know it's there, but you just don't want to focus on it. Symbolization, unconscious, an idea or object is employed to represent some other idea or object or person. So reciting the Pledge of Allegiance or saluting the flag. Louis carries a four-leaf clover and a rabbit's for good luck. So this one's pretty self-explanatory as well. Undoing, so doing, then undoing. I would say the best example here would be this one. I think it's like the last year there was a question like this. So Joe is nervous about his new job and yells at his wife. So on his way home, he stops and buys her some flowers and himself a new video game. So basically, he yelled at his wife, and in order to undo those effects, he thinks that by buying flowers, he can undo those effects. All right, and this is a good picture too. Eating junk food and then working out of guilt. You're doing something, then you're just trying to undo it. Somatization is psychological conflicts are expressed through painful complaints. So this is unconscious as well. Idealization is unconscious. Overestimate desirable qualities and underestimate limitations of person or object. So a senior medical student has elected a hospital for an internship and residency. The mechanism involved when he describes the hospital and its program entirely is superlative in his idealization. Right, so you're just overestimating desirable, underestimating limitations. So just talking something up and never really talking about bad qualities is all that. I know some of them are a little bit similar, like somatization and the one dealing with um, the woman up here. It's almost that. This one, they can be a bit similar, but honestly, like it's they're all multiple choice your defense mechanism questions, and she's not going to give you ones that are like similar. She's just going to give you guys ones that are not really similar, so it's going to be easy for you guys to pick it out. So your midterm is going to be fine, so try not to stress about it too much. Just try to just learn all your defense mechanisms, all the differences. Your only conscious ones are fantasy, and then the last one we talked about. Which one was that? Suppression. So just know that those are the two ones that are conscious, all the other ones are unconscious. Uh, and yeah, it's gonna be pretty self-explanatory, so you guys will be fine. Just do the practice questions from the homework that she gave you guys, and just get used to all those examples and doing those examples, and you'll be fine. Therapeutic communication, just know all the words that you should not say to a client, and mainly just look at what's focusing on the client. Those are also pretty simple questions as well. You guys will be fine. Um, any questions with anything?